Good morning, everyone. Today we are going to see about the topic peptic ulcer disease. What is meant by peptic ulcer means simply we will another name of peptic ulcer disease is PUD. So what are the facts behind the peptic ulcer disease? So peptic ulcer is the which is a breaking down of the lining segment in the GA system, especially in the stomach. We can able to see the difference of ulceration formation in the GA system. So it mostly located in the lesser curvature of the proximal stomach or in final part of the duodenum. So we can able to see the ulcer in the final part of the duodenum or in the lesser curvature of the proximal stomach. So this incidence rates are roughly about 0.1 to 0.2 in the population per year. So it is more than gastric ulcers we can say, but it is also the causes will be what are the causes for the gastric ulcer or is the peptic ulcer is H. pylori infection and the using of prolonged using of NSAID meds like that. So by using the NSAID meds like painkillers like that, we are using prolonged means it causes a peptic ulcer in our stomach. And also rather than the H. pylori infection, it's a bacterial infection which also causes the peptic ulcer PUD disease. So H. pylori is the gram negative bacteria which causes ulceration. So it can be involving the increasing of gastric acid secretion by inducing histamine to act on the particular cells. So it will be damaging the cells and reducing the production of the bicarbonate production. So it will cause the ulceration in the body. What are the clinical features? What are the symptoms we can able to identify? Means difficulty in swallowing, discomfort will be there, epigastric pain will be there, and the burning sensation will be there. The diagnosis will be like that. What are the things means endoscopy can we do, and other than that we are using the diagnosis like that. What are the things we can able to identify? How can we able to identify means urea breath test, stool monolocal antigen test like that we can able to do, like culture we can able to do. What are the things we will able to do, and we will able to find out the things. So to recover from these the things like they will give the medicines, and they will give antacids and medicines like antinomiprazole they can give. And the main thing is diet modification. We can should take the diet in a appropriate time, and weight loss, smoking cessation, and other than that avoidance of use of NSAIDs. And drug therapy is mainly important. Before taking the food we want to take omeprazole medicine. So these are the these are the things we want to do fundamentally to reduce the peptic ulcer disease. And we want to change their diet modification. If they are taking any acidic diet, we want to change the acidic diet into alkaline diet. So what are differential diagnosis means? If the patient is having peptic ulcer disease, they sometimes it's a possible of having esophagitis, functional dyspepsia, gastritis, gastroenteritis, GERD, and less likely most common things are above I mentioned, but less likely means is of IBS, IBD are the less. If it is controlled, and if it is not controlled and prolonged, it is a peptic ulcer, then will be leads to IBD, IDS. IBD means in intestinal inflammatory bowel disease, and inflammatory bowel disorder we can able to say. So these are things we know about the peptic ulcer. Is a very useful thing, I think so. So if you are thinking like that I am having peptic ulcer, like the symptoms like that, you can able to know about all the things, and you can use the diet modification to become to reduce your peptic ulcer disease. Thank you.